Once these things come into play, no vital signs, no respiration, no pulse, no responsiveness, 12 o'clock. At that point, that is your time of death, 12 o'clock. First thing you do is you contact the office or you contact your doctor. For the most part, our medical director is Dr. Ahai Nguyen. And his number will be available. He usually prefers a text because he's always there for us, but he is busy as well. He is a doctor and has other cases. So what we want to do is we want to reach out to him. Hi, Doctor. Hi, this is Shanice. Just wanted to notify you, Mrs. Smith has expired at 12 noon. He'll text you right back. All our doctors are great. They always respond very rapidly. Thank you, Shanice. That's the time of death. Okay? Okay. After the time of death, we got a little bit of work to do, the post-mortem care, right? So once the doctor has been notified, we need to find out if there's a mortuary in place. All of these things should already be in place prior to the patient expiring. This is all part of the care that all the information we get during admission. Okay? So this mortuary information should be inside of the binder. If it's not, try looking on Slack. Usually all of this information is put at the very beginning of the thread when we're introducing the patient on Slack. All the patient's information. Usually if you scroll all the way to the top of the patient's Slack thread, you're going to see name, date of birth, address, contact person, DNR, mortuary information. Also, if there's anything, you can also look on Hospice MD. It's usually on there as well. Hospice MD, our staff, our office staff will go ahead and put everything on Hospice MD. So you're able to look at the information in there. I want you to note this, guys. Riverside County is the only county that needs to be, where the coroner needs to be called prior to calling the mortuary. So we need to call the Riverside County coroner to inform them of the death. Okay? When you call them, you say, Hi, this is Ulysses. I'm with Amici Hospice. I am a nurse. I'd like to report a death. They're going to ask you for basic information. When you do call the coroner, I recommend that you have Hospice MD open because a lot of the information they're going to ask you will be on there. Can I have the patient's name, date of birth, who is the attending doctor, what is the diagnosis? They're also going to ask you questions like, was there any trauma, any head blows, anything of that sort? No, ma'am. Is there do you suspect any foul play? No, ma'am. Is there any overdoses? No, ma'am. Is the family at bedside? Yes, ma'am. Is there a mortuary in place? Yes, ma'am. Very basic questions, but you don't want to leave them on hold by, what's the date of birth? Hold on, let me get it. Then you're feeling the pressure, and no, we want to make sure that everything runs smoothly. So if you stay ready, you don't have to get ready, right? So all of this information is on Hospice MD. Once the coroner is done with their questions, they are going to give you either their badge number or their last name. Okay, let them know Agent Fox. Okay, Agent Fox. Or they're going to say, okay, this is Agent 462. 462. And this is only Riverside County. Okay?
And I do need that for the death worksheet, or just for Riverside, so you guys know.
Okay. So once we have that, hopefully there's a mortuary in place. If there isn't a mortuary in place, we got to reach out to our social worker, either the family or if the patient needs assistance, we reach out to our social worker, Araceli. And we let her know, hey Araceli, can you please assist family with the mortuary?
Come in. Hi, quick question. I just want to know who the 213 number is, so I can write you down on the in-service sheet.
213?
Yeah.
Maybe that's me.
I don't think so.
Asking for
Could be me, I don't know.
Who's the 213 number?
Is that Huang? I don't know, no.
No, I Huang 669. Because
Okay.
I don't know who that is, and if I don't know who that is, I'm gonna have to kick them off.
Can't see the whole number.
No, you can. It's 213, and then the last two are 95.
Yeah, then you should have all the phone numbers.
No, I looked, but it's from someone from like the sniff I worked at.
Oh.
Okay.
From our pack.
So, if mortuary is not in place, we reach out to Araceli for assistance. Also, when you're doing your SN visits, it's a good idea to remind the patient, guys, have you looked into a mortuary yet? And I'll explain why, because the last thing you want, and you explain this to the family, look, I just want you to choose a mortuary that fits your needs, because if the time comes, unfortunately, you might get a mortuary that you're not very happy with. It's not going to be your choice. It might not even be what your culture is used to or wants. So I really recommend that you start looking into it. It's worth it because, you know, you might get something that you don't want later. This way, you can inquire about budget, about services, about cremation, any of these things. So just start instilling that into your patient. You never know, because you could be that death call nurse that goes to see your patient. So if you're on it already, then that death call is going to be easy, in and out, you know. And this is what we're trying to get at right now. So,
Come
hey, is that Wang?
Thanks.
Guys, let me introduce Mr. Huang. Huang is one of our LVNs for OC, for LA. Actually, he's been all over the place, and thank you for your hard work and thank you for making it. Mr. Huang was actually on his way here earlier, but we did have a death. He did do a death call, so he got redirected to go do the death call. He's now here with us. Thank you, Huang, for doing the death call. I appreciate it. This is actually what we're talking about right now, the death call process. Okay? So, once again, we call Araceli if there's no mortuary. Okay? Also, reminder of telling the patient's family about getting a mortuary prior to the patient expiring, right? Remember, we got to be sensitive about this. You know, you don't want to use, you want to be ready when the patient dies. No, you know, you just pick your words and make sure that we're sensitive about it. If the mortuary is in place, same thing. You call the mortuary. Hi, my name is Ulysses. I'm calling to schedule for a pickup. Okay, Ulysses. Ulysses, what is the patient's name? It is Mrs. Smith. All right, you know, they might ask you for Social Security, date of birth. Okay, December 31st, 19 so-and-so. Okay, great. What time was the time of death? Noon. Was the family at bedside? Yes. Does the patient have any, what is it, not communicable diseases? Is that?
They asked diagnosis, doctor,
Correct.
company.
Pretty much the same thing the coroner did, but they will ask you if there's any diseases or anything. No. Is there any other diagnosis? This is where the hospice MD comes into play. You want to have that open so you're able to just get quick answers, right? Okay. Does the family need? Is there any steps at the home? Is there any obstacles? Is the patient upstairs? These are all, no, the patient is downstairs. There's actually one step at the porch. Okay, good deal. Does the family need more time with the patient, or can we pick the patient up as soon as possible? Family prefers as soon as possible, please. Okay. We're reaching out to our team. It looks like the ETA is about 2 hours. Perfect. Okay. So now that we got the mortuary, we inform the family. Guys, looks like, you know, Mrs. Smith is going to be picked up in about 2 hours. So this is a good time. Let's remove any jewelry. Let's remove any tubes that the patient might have. The nasal cannula. If they have a watch, they have earrings. Let's go ahead and remove all of these things and give them to the family so they can go ahead and take care of that.
Post-mortem care.
Post-mortem care, yes, sir. Post-mortem care. You also might want to tell the family, you know, if you have any clothes that you might want to give the mortuary, or the mortuary will reach out as well, but just keep in mind, you know, any clothes that you want her for her service or anything of that sort, it might be a good time to start picking some of these things out, right? Guys, we want to remember that when the patient passes, there's a good chance that family members will come in and view the patient. So you want to make sure that you do your part as well. Make the patient presentable. Put them, fix their, you want, rigor mortis is going to set in, so you don't want to have them sitting up. I learned the hard way. You don't want to do that. Rigor mortis, you want to make sure the patient lies flat. Okay? You want to make sure that they're presentable. Make sure you fix the bed. If they've used a restroom, you want to make sure that you clean them fairly quick, right? So they don't smell when patients come on in. This is all part of our service. You want to make sure that patient laying flat with maybe their hands across their chest. You want to maybe even get a washcloth, wet their hair, comb their hair a little bit. You want to make sure that they look presentable for other family members, right? You don't want them with nasal cannula. Patient's been dead for 2 hours and is still going at 3 liters per minute. Right? That's something that we don't want, right?
Another thing,
yes.
sorry, I usually do is you roll up a little washcloth and put it under because do that, or even what else? There's
you get a washcloth, you put it under, you can tie it up like Tupac, and it closes their mouth, right? Because rigor mortis will step in.
What about putting a cloth over the patient sometimes? No?
I mean, if the family doesn't want the patient to be viewed, then at that point it's family's request. But for the most part, we would just want to make sure we set them up like if they're sleeping comfortably. Yeah. Because neighbors are going to come over, family members, grandchildren, all of these people, and you don't want them like, they're like this and then their hair's all messed up. You want to make sure they're presentable, guys. And this actually makes us look good as well. And if you're there, you want to give your condolences to family. This is why we're here. I'm sorry about your loss, guys. I'm sorry, my prayers are with you. Is there anything else I can do for you? Can I offer anything? We do have a chaplain that's on hand and available at this time. If you feel like you don't want to talk to him now, let me have him reach out to you tomorrow morning to see how you're doing, right? Social worker, is there any services that you might need? Do you need help with cremation? Do you need help with anything? Do you have an urn? Things that our social worker can help out with. At that point, we want to make sure that the family has less to worry about, so they're able to grieve and be with the family members and be together as a family. And we'll take care of all the stuff, all the hard stuff that was very hard to take care of when you just lost a loved one, right? Like I said, I did it last night. It's all of these things that I'm telling you. I'm right there out on the battlefield with you guys. I'm not just delegating. I'm not just telling you. This is things that I still do personally, whether, like I said, I'm an LVN, whether I'm an owner, whether I'm a director, all of these things. This is stuff that I still do. And if you're invested in your team, in your company, in your care, then, like I said, it's not about the title. It's just about doing it and making sure that we provide the quality care that we promised initially. And this is what's going to keep us going. This is what's going to separate us from the people that ain't doing that. This is what's going to help us grow, build a reputation, a rapport with hospitals. They know if I call Ulysses and I call Amici, the job is going to get done. It's going to get done right. We're going to have communication. We're going to have respect. And Amici's going to help us look good as well. The last thing we want is the family to say, hey, doctor, that company that you referred me to, what the heck? They didn't care. They just came in. They were late. They didn't call. They came in all in a hurry. They didn't communicate. That's not good. It's quality, quality, quality. We have to reinforce that over and over again. And like I said, it's repetition. If you just make it part of your care, then it's just second nature. You do it without even thinking it. And it just makes you a better nurse. It makes you a better person. And it's always nice when the family tells you, Shernice, you made all the difference. I love it. Like, I had a family the other day telling me, Shernice was amazing. Digna was amazing. Thank you so much for your team. Man, if it wasn't for Shernice or for Digna, I don't know how I would have got this. They were educated, they were respectful, they were here on time, they educated me on why the meds were taken, what it was for, and it makes all the difference. And thank you, Shernice. I love to hear those kind of compliments, right? I also love to hear the compliments within our own office staff too, who are like, oh man, Shernice is, and right now, because that's the example I can think of right now, but Shernice is doing PRN calls. Oh man, I'm glad she came through. Thank you. You know, it's like, all right, you know, and this is where you start building that rapport. This is where we end up wanting instead of we want to make sure that you don't leave now because this is creating value for the nurse, right? So now it's like, let's take care of Shanice, let's take care of Veronica, let's take care of CM, let's take care of Myra. We don't want Myra going anywhere for sure, right? So it's like, let's make sure we take care of them because they're willing to go the extra mile for the team. We don't have to ask them, we don't have to, you know, wait on it. She does it because she cares for the team, she cares for the patient, and she wants all of us to succeed as far as teamwork, right? All right. So that is our death call. Oh, I mean, yes. After that, I mean, once mortuary's been called, everybody's been called, then yes, you give your condolences. You let the family know if there's anything else that they need. We don't need to stick around for 3 hours until the mortuary gets there. Yes, Ms. Myra.
Oh, I have a very important question.
Sure.
What do you guys want for lunch?
Ooh.
That's very important, yes.
So I can start ordering.
I'm open. What are you guys moody for, guys? Anybody? Any suggestions, please? I mean, we appreciate you guys coming. Rodney always has some good
What do you want,
suggestions.
Wayne?
Rusty?
I'm easy.
I'm easy.
Huh?
Anything.
Let's say pho.
I still want to know who's the 213 number is.
2, 1.
It's my double, my.
Oh, okay, because I was about to kick it out.
I'm just kidding.
I really don't know.
So then ask them.
Mara,
Good enough.
what we have, so give him some,
Okay, so options
All right. So
are
we'll take a quick break.
yeah. We
Pause
just
the
have
video.
one.
Pause the video.
Yeah. We'll go